one of the Philippines' earliest inhabitants. The Manobos live by the rivers and hillsides across different parts of the southern region of Mindanao. Visits here are rare, and so our arrival was treated with a ceremonial dance. Over the past decades, the Manobos have been driven from most of their ancestral land. Armed conflict has plagued most of their communities for decades. This has also caused the collapse of the health system in so many areas. Shirley Villar gave birth to her 3 children in this house. She had a traditional birthing attendant or hilot who helped her. There were no doctors or hospitals, and medicines were non-existent then. Her daughter, Michelle Villar, is due to give birth to her first child next month. She says, unlike the earlier generation of women in her tribe, she is willing to discuss reproductive health. There are no health centers nearby, and she travels for kilometers just to go for her prenatal checkups. So she says she will most likely give birth in the house too.
Wala na po kaming choice kung
I do not have a choice. There won't even be time to go to the ambulance. I may have a scheduled delivery, but what if my baby doesn't arrive the next day? There wouldn't be enough time.
Women from indigenous communities are among the most marginalized in society. In Mindanao, where more than 60% of indigenous people live, most of the women do not even have access to basic services. This birthing facility does not even have half of its much needed equipment. There is no incubator. It doesn't even have a single ultrasound machine. But health workers say they do what they can, and this facility is already the best in the area. The local government admits there should be a stronger focus on health care for mothers belonging to indigenous tribes.
All in all, 3 doctors for this 160,000 people. So we need additional personnel like doctors and nurses.
President Rodrigo Duterte promised to implement the reproductive health law that was passed by the previous administration. It aims to strengthen access to maternal and reproductive health and institutionalize safe-sex education. The government wants to promote the rights of indigenous communities, but many of the women here say their rights when it comes to reproductive health have largely been neglected. Jamela, Alindogan, Jazeera, Panabo, Southern Philippines.